Bore da, diolch yn fawr, diolch am y gwahoddiad I ymuno gyda chi y bore yma I nodi 20 mlynedd ers sefydlu grŵp strategaeth meddyginiaethau Cymru gyfan. Thanks very much for the invitation to come and join you to celebrate the 20th anniversary of the All Wales Medicine Strategy Group. And before I start, I'd just like to pay tribute really to Nicola Wheatley and to thank her for all the work obviously that she did for the Poisons Unit, and I know you'll be commemorating her today, so diolch yn fawr iawn am hynny. It's wonderful to be here in home of football, a few days before the Football World Cup, and it's great that we're going. So that's absolutely marvellous, and we won't say anything about the Prince of Wales and where his allegiances lie. So thank you so much. I'm just so frustrated because that was just so fascinating and so interesting. And this is where the magic happens, isn't it? This is where really the change occurs, and it's just so lovely. And I think I've been health minister now for about 18 months, and I'm married to a GP, and you can imagine our pillow talk has changed a lot. And the one thing I've learnt in that 18 months is that I've got so much more to learn, and in particular in this field, this is really where the magic occurs, and I just want to thank all of you for your efforts. And in 2022, access to new medicines has a greater potential than ever to make that meaningful difference to the quality and to the length of people's lives. It's really interesting, isn't it? We've got an ageing population. We're not a particularly healthy country, if we're honest. We don't look after ourselves. I was just reading this week, in terms of screening and things, and it was saying, well, you should be doing 2.5 hours, exercise a week. And I thought, 2.5 hours, that's quite a lot. I kind of think I look after myself, but I definitely don't do 2.5 hours. And I just think, actually, at some point we're going to have to get to a point where we have a really serious conversation with the public in Wales about their responsibility, because the situation at the moment is unsustainable, and we've got an ageing population. And the one thing that is clear with this ageing population is that we're going to have multiple problems happening in people at the same time. So it's not just about how old you live, it's about your quality of life when you are alive. And innovations in the development of medicines means that now many people with conditions which historically have been severely life-limiting, they can live longer and fuller lives. And it was lovely to see that example there. And of course, the problem is that this comes at a cost. And today is budget day, and I can tell you we are very, very nervous about what we expect to see today. The NHS in Wales spends more than £1 billion per year on prescribing medicines, and in particular costs associated with new medicines used in our hospitals have grown by nearly 40% in the last 5 years. And it was interesting, we had Gordon Brown here this week, and I was telling him how much the cost of energy's gone up, just to give you an example of what we're confronting more generally in the NHS at the moment. I've had a £207 million bill for energy that I wasn't expecting when we made the budget. And I only had £170 million to clear the backlog. And there's no extra money, so we've got to find that from within what we've got. And he reminded me that actually, don't forget the medicines, because actually lots of these medicines we buy from abroad, and the value of the pound has, of course, plummeted, and that means they're much more expensive. So if you think the challenge was hard before, it's just about to get a lot harder. And that's happening at a time when demands on and expectations of the NHS are higher than ever, when costs are rising, when public spending is constrained. It's absolutely imperative that we target our resources to those areas where the value and the benefits from our investment is greatest. And for 20 years, the All Wales Medicine Strategy Group has been at the forefront of helping us make those genuinely difficult decisions, building a reputation not just in Wales, but across the UK and internationally. It's really good to hear that here in Wales we do seem to be a little bit ahead on some of these things. It's not true for everything in the NHS, so it's really nice to be able to say that. Some of you will recall the establishment of AWMSG following a report published in 2001 by a task and finish group on prescribing that was chaired by Sir Norman Mills. And that report had three principal findings. Firstly, it noted the importance of recognising and improving the knowledge and experience of doctors in prescribing and in managing therapies. Secondly, it stressed the importance of involving patients in decision-making. And finally, it called for a closer relationship between the NHS and the pharmaceutical industry to ensure that issues in the prescribing of medicines could be discussed and resolved in an open and a transparent way. Now, to address its findings, Task and Finish Group recommended a national committee to be established to advise the Welsh Government on medicines and on prescribing, with the aim of improving all aspects of prescribing and the provision of medicines in Wales. And from that, the All Wales Medicine Strategy Group was established in 2002. And since that time, I and my predecessors have come to rely on the committee's independent, authoritative and expert advice on strategic developments in all matters relating to the prescribing and the use of medicines in Wales. Over the 20 years it's been providing expert advice, the AWMSG has assessed, considered and made recommendations on the use of more than 420 medicines. And the strength of those recommendations is that they are developed taking into account the views of experts from across the broadest range of disciplines within the NHS, consultants, GPs, nurses, pharmacists, and other healthcare professionals who use medicines in their everyday practice. The recommendations benefit from the expertise of health economists to help understand and quantify the value of every medicine, and also from the pharmaceutical industry, ensuring we take account of the broader societal and economic benefits from a strong, vibrant life sciences sector. And most crucially, from patients and their representatives who help us understand the experiences of people living with the illnesses these medicines are intended to help. The All Wales Medicine Strategy Group has for 2 decades been bringing that expertise together to assure successive ministers, clinicians, patients and the public that the medicines we recommend are not only clinically effective, but also that they're cost effective and they're made available promptly and equitably for every eligible person in Wales, regardless of where they live and where they receive care. And that's really important as somebody who's based out in St David's in Pembrokeshire. You do feel like you're at the end of the line there, and you do have to know that actually, if anything happens to my family, they have to have the same access as my family here in Cardiff. Prompt access to treatment is something that is incredibly important to patients and clinicians. And that's why in 2017 we launched our new treatment fund, providing £80 million, which is not a small amount of money, over 5 years to speed up access to new and innovative treatments recommended by AWMSG or the National Institute of Health and Care Excellence. Now, since its inception, the fund has provided faster access to more than 450 medicines used to treat over 100 different health conditions. Today, the average time taken to make a medicine routinely available across the NHS Wales after being recommended by AWMSG is 16 days, which I think is quite remarkable. And before 2017, the average time was more than 3 months. Now, when you're really in a difficult situation, that makes a huge difference. And I think it's really important that people understand the direct benefit of the new treatment fund. Not only are we making access to innovative medicines faster, we're also making access more equitable. In particular, ensuring our appraisal process is flexible enough to deal with those treatments for rarer conditions which affect a relatively small number of people but have a disproportionate effect on their lives. But AWMSG's role is far broader than recommending which medicines should or shouldn't be used in the NHS. The committee is also constituted to provide advice on how medicines are prescribed and used to achieve the best possible outcomes for patients and the NHS in Wales. Ensuring the best possible care for everyone is a Welsh Government priority. We must ensure our health services treats all conditions and diseases as fairly as possible. Taking an evidence-based approach helps us do this by ensuring resources are targeted to where patients will gain most benefit and the cost of a medicine is in balance with those benefits. AWMSG operates a clear, transparent and consistent process for developing advice and tools to support prescribers to do this. Through the work of AWMSG and its various subgroups, a wide range of resources has been produced with many examples of clinicians embracing those resources to deliver significant improvements in the way medicines are used in every NHS organisation in Wales. This work is showcased through AWMSG's regular Best Practice Day, and I know many of you will have had the opportunity to attend this year's Best Practice Day, which focused on the environmental impacts of medicines. And we, as you know, have an ambitious target in the Welsh Government to achieve a collective net zero situation in the public sector by 2030. 2030 is round the corner, so we've got a lot of work to do really, really quickly. As the largest public sector contributor, the NHS has to play its part. AWMSG has been working across the NHS to support initiatives to help achieve the aspirations in our decarbonisation plan. The All Wales Prescribing Guidelines for Adult Asthma and COPD, recently agreed by AWMSG, has been groundbreaking in the way it directly recognises and takes account of the environmental impact of medicines when they're making decisions about care. Now, our aim is to reduce prescriptions for and to transition away from high global warming potential to more sustainable inhaler choices in people with asthma and COPD. Now, the guidelines support shared decision-making to optimise the health of patients, but also to consider the health of the planet. AWMSG's decarbonisation dashboard, launched earlier this year, is allowing us to monitor the prescribing of inhalers within primary care. And data from the dashboard is demonstrating that already we are saving, this is quite remarkable, 535 tonnes of CO2 every month relative to the same period in 2021 as a result of reduced and improved prescribing of inhalers. That's a carbon saving equivalent to travelling almost 2 million miles in the average car. So well done. I think that's something that's certainly worth celebrating. The ability of the All Wales Medicine Strategy Group to adapt and respond to the NHS's changing need for advice on medicines use will be critical, I think, in ensuring the committee and its work remains as important to the NHS in the next 20 years as it has been in the last. AWMSG and its subgroups have a critical role to play in ensuring that Wales is a great place to live for future generations, and it's a healthy place, it's a globally responsible place, and it contributes to us wanting to reach a more equal Wales. Mae heddiw'n gyfle I ddiolch i'r grŵp am bopeth maen nhw wedi wneud yn ystod yr 20 mlynedd diwethaf, ond hefyd I edrych ymlaen at ddyfodol o rannu uchelgais am well gwerth, llai o wastraff a chynlyniadau gwell I bobl Cymru. Today is an opportunity to thank the All Wales Medicine Strategy Group for everything it's done in the last 20 years, but also to look forward to a future with shared ambitions for improved value, reduced waste, and better health outcomes for the people of Wales. Diolch yn fawr I chi gyd. Thank you.